Hello everyone, I'm Gary Summers and welcome to the audio edition of Mind, Body, Soul. I'm here with a returning guest because Tiffany Ludwicki always has some interesting things about her work and what she's doing to help people with her oral health. So welcome, Tiffany.
Hi, thank you so much for having me again.
So Tiffany, I guess just tell our listeners about your new clinic, because you've just moved in and you seem excited.
Yes, I am. A little bit about myself actually, and about the clinic is like, I don't even know where to start. I have my hands in so many buckets, like you mentioned. I always have something on the go, but I am a dental hygienist. And right now I'm actually the current president of the Canadian Dental Hygienist Association. So just a disclaimer, though, that everything I speak about is me personally as a hygienist, has nothing to do or any affiliation with CDHA. Sure. But I'm also a health coach and a myofunctional therapist. And today, obviously, we're going to talk about my clinic and my dental hygiene background. I opened my business a few years ago, and it was Mind, Body, Mouth. And I added dental hygiene to that a year and a half ago, but came across some challenges at the time that I just couldn't deal with. And I wasn't really able to grow the hygiene part because I was still working full time for a couple different dentists.
And then a baby came along.
And then, yeah, that was an unplanned but very wonderful surprise. So I actually had my baby girl 2 weeks into the COVID shutdown. So she is a COVID baby. And a month later, because of all the COVID issues, the place where I was at, they had to break their lease. And I was given less than 2 days to completely shut down my clinic and get everything out. Otherwise, everything was going to be lost to the owner of the building. So my husband and I filled up my little Subaru, or medium-sized Subaru, with a baby, cut down the whole clinic. We realized our truck was actually out of service at that time, so it was quite a disaster. But I thought then at that time, you know what, I got a new baby, the presidency, I was working for somebody else. I just didn't really have the time that this was it. I was just going to consider it all a loss. But turns out that's not really my style. So...
And you wound up back on your feet.
Yeah.
Better than what you were before.
Yeah, well, let's hope, really. When the world opened up again after COVID, dental offices were hit really hard, like all offices. They're now even still only able to see 80% of their population. So if you consider how many people either don't have regular visits, or if they did see a dentist in the past, now to get in, they're months and months behind the regular appointment time, and trying to get in is difficult, and it's really bad. And I can explain later in the interview why it's so important to have their good dental appointments and good hygiene. But pretty much, as you mentioned, landed back on my feet. An opportunity arose, and I felt compelled to offer this service because I'm so passionate about it. My husband took over paternity leave instead of my 4-month-old baby. I created a partnership here with the Monastery brand. I invested in state-of-the-art air quality systems. So this will recirculate the air, but also scrub it down clean. So every 7 minutes, it's brand new air in this clinic. I have high volume suctions to work on aerosols. I have all the necessary PPE. And really, I converted a hotel room into a fully functioning clinic in the interim of building a whole oral health facility eventually upstairs.
Because we are here in your clinic now.
We are.
And we just finished my first oral appointment with you.
You did, yes.
So I can give first-hand information. And before we go on, I would highly recommend to our listeners to go back and listen to Tiffany's first interview, because she did talk about myofunctional therapy, which is eye-opening. I mean, incredibly eye-opening, which I had no concept about it at all. Plus, I also, when we did this, you did my work, there was things that you did that I hadn't had done in my teeth cleaning before. So, tell us exactly what is Monastery Oral Health.
Okay. Well, the whole idea of Monastery Oral Health is to be like a full functioning wellness clinic, but with an emphasis more on our mouth, how our mouth impacts our overall health, and vice versa. A lot of times we don't realize the impact of our oral health when it comes to our mental health and well-being as well, and our physical health when we're dealing with with other like chronic illnesses. So it is not just dental hygiene. I do have a colleague here as well. So there are dental hygienists, but as you mentioned, myofunctional therapy, that is in the world of dentistry, but it's also in other worlds of naturopathic therapy, which that's what I treat that under as naturopathic therapist. But the whole purpose of all this is to also have a referral system to other practitioners. So when I see things in people's mouths and in their medical history, things that may not be addressed in the past, I can refer them to other sources such as craniosacral therapists, a rolfer, physiotherapy, coaches, and sleep specialists.
Because when I first started in the chair, you went outside my mouth first and did some feeling in my chin and in my jaw and things like that. So what were you doing there?
Yeah, that's actually, it's kind of nice to consider it a little massage to relax you before you get started.
Yeah.
But it is an oral cancer screening. If I were to see something in your mouth, it's pretty much stage 4 cancer. There's things that we don't find in the mouth until it's really far gone. So I'm feeling for any inflammation of the lymph nodes to see if there's any signs of an infection deep rooted that we can't see yet, as well as it tests for function. A lot of times, people have sleep apnea because they have like swollen tonsils, and they might have dysfunction in their jaw, which is leading to things down the road. So I'm looking for asymmetries that could indicate there's a deeper problem. So that's really the approach, is oral cancer screening and dysfunction.
When you were doing my cleaning and you talked about inflammation. Mm-hmm. And a lot of people don't really think about inflammation that can cause, when you talked about cholesterol and things like that, when your immune system is working so hard on fixing the inflammation in your mouth and it can't fix it, and then it may compromise something else. Can you just talk and explain that a little bit? Because that's fascinating to me, because most people, you said brush your teeth for 2 minutes, angle the toothbrush. Yeah. I'm sure people are not brushing their teeth the way they should be brushing their teeth. So just talk a bit about inflammation and the problems there that people really need to take more care of.
Yeah. This is a huge topic, really. Research is still being done on causation, like what's causing what, but there is a lot of evidence to show that inflammation in our mouth, so bleeding gums, is a risk factor for chronic disease like heart attacks and strokes, diabetes, Alzheimer's disease. It can even actually create negative birth outcomes just because of the hormonal effect that it can do. But pretty much what happens, if you think about it, if we have bleeding gums, it means that we have a passageway for blood to get out of our body. And that's happening because there's bacteria there. Our body's trying to clean the bacteria out. So it's sending the blood there to fix the problem. But by opening up those blood vessels and allowing the blood out, that's a passageway for that bad bacteria to get into our body. So now, if you consider all the stresses that we're under in day-to-day life and then add on hereditary risk factors that we already have, you have this bacteria circulating throughout your system. So it could end up getting caught up along our blood vessels, adhering to the blood vessels. And what happens then? The body will create cholesterol to go and block it off. Like, we think about cholesterol as a bad thing that comes from food, but our body makes 90% of the cholesterol.
Absolutely.
Yeah, so it's kind of like blaming the firefighters for starting the fire, because every time we see a fire, they're there. So cholesterol is actually your body's trying to defend itself. So if we can hopefully reduce the bacteria that gets into our blood system, then we can hopefully reduce the chance of the long-term effects that cholesterol can have, like the heart attacks, the strokes and clots and so on. And then, not to mention like the link with diabetes, if we have this bacteria circulating our blood system and we have high sugar, well, bacteria eat sugar. So you're feeding this bacteria throughout our system. So our body is so compromised when it comes to healing because it's being attacked from so many different ways that people, especially with diabetes, need to make sure that their oral health care is top notch and that we're doing everything that we can.
A dental hygienist without a dentist.
Yeah, interesting.
That's very interesting. But I would have to say that that hour and a half that I spent in your chair was very thorough. And I know you found things in there that I didn't realize, that the buildup of bacteria underneath the gums and things like that. So just talk about how that would work, where someone might say, well, you're on your own. Why that and not, why not a dentist?
Right. Yeah. Well, they are two different things. And dental hygienists, they've been able to work on their own for many years now, but most just choose to work for a dentist. It's easier. To be honest, I don't blame them. Being a business owner is a lot of work, more than I planned on. But it is interesting because people don't realize that we can work on our own, and that it's been an option, and that it is two separate professions. So dental hygiene it's really focused on prevention. It's on disease management, where a dentist, even though, yes, they care about that, that's why they work with hygienists, they're more intervention once there's a problem. So it is great to have them. It's a great model that they've had in the past. But for me, like, my passion to offer this service at this level is what's driving me to go out on my own. So I chose to open this clinic without a dentist. Now, here's a caveat. This is in its infancy. My clinic is in its infancy, and it is an overall health clinic after all. So down the road, when I find the right dentist, hopefully someone interested in the natural type of modalities, then, when they can follow my vision, then we'll be expanding. And of course, I would want to work with a dentist.
Absolutely, sure.
Yeah. But I digress. Why my experience here is that I wanted to break away from the mouth being its own little entity and start to put that into a more holistic approach on the mouth and the body being a unit. I want to collaborate with medical and dental professionals. I want to be able to discuss how lifestyle can affect your mouth and how your mouth can affect your life. So as a happy result of being on my own, I do get to have control over my schedule. I get to dictate how long my appointments can be, give the appropriate time needed for every patient based on their needs, and obviously then purchase the instruments and the materials that I feel is going to be best for me and my clients.
You're a pioneer.
I like to hope I'm paving the way for a lot
Absolutely.
of good in the future, because it has been hard, very, very hard.
So we just went through my visit. Can you quickly, not too quickly, just go through start to finish as to what you would do for a first-time client who would come in, to sit them in the chair and just go through that, as don't rush it, but just
Right.
so that people get a good idea as to how thorough you are.
Okay. Yeah, I do tend to talk fast. I get really excited. So
That's a good thing.
Good. So pretty much what I would do, I am observing how a person is walking. I do check their gait, look for any, any compensations in their body, because that can lead to, are there issues with any functioning? Unfortunately, right now, because we have to wear masks, I'm really limited in a really important aspect, mouth breathing. I can't tell if people are breathing through the mouth, and that can lead to a whole host of oral health problems and other problems. But that is one thing that I'm finding difficult right now. But once you are then sitting in my chair, new protocols are you have to rinse with some mouthwash with hydrogen peroxide.
Because it looks like a dental chair.
Yeah, fully functioning, automatic, the whole thing. So yeah, you have mouthwash, and then, like you mentioned, like the massage earlier, I am checking your outside of your area, your head and your neck area, for lymph nodes. I'm getting you to open and close your jaw so I can feel how your jaw is operating, if there's any jaw pain, if there's clicking, things that could indicate an issue down the road or now. I'm looking in your mouth. I want to assess the airway. I want to assess the color and the shape and the textures of your oral cavity and your airway. Then I lay you back. I'm doing the inside exam. So I'm feeling things. I'm looking at textures. I'm feeling for lumps and bumps, any discolorations of the tissues, the mobility of your tongue, and getting that assessment. From there, I then start a gum health assessment. So I'm measuring a space between our gums and our teeth. It's kind of like, if you have a hangnail and you peel off the hangnail, the cuticle, you have that little space. Every tooth has a little space, but we unfortunately don't have a cuticle to block the external environment from the internal one. So I'm going and I'm looking at the health of that area. So I'm taking measurements all throughout the mouth, and then measuring whether or not your gums have receded, whether it's from over brushing, which people think is the most common cause, but often it's from clenching or grinding or bacteria that's causing your gums to retract. So I'm measuring those. I believe in baseline information. I don't care how healthy you are. If you know where you are now, that's the best indicator to know the future.
Absolutely.
Yeah. So I do that full assessment. And then I have a material like...
Because you mentioned to me, I grind my teeth. Mm-hmm. I was never told that before.
Yeah, and I don't know if that happened 20 years ago or if it's happening now. Right now, and this is why baseline is good. The younger you have this information, then we can monitor it over a lifetime and figure out what's going on.
Sure.
Yeah. So, okay, so that assessment. So then I paint on a product onto your teeth. This is a learning thing, not just for myself to know like where I need to clean, but it gives me an idea on what type of bacteria is in your mouth.
And that is new to me. And that was very educational to me too, because you can tell how old the bacteria is in your mouth, or the plaque, how old the plaque is in your mouth.
Yeah.
So just go through that. I found that fascinating.
Yeah. So I paint it on. It will stain a couple different colors. Plaque will, like new plaque. So we all have plaque in our mouth. We need it. It's a combination of bacteria that actually helps with digestion. It's just a natural part of our saliva. So pink is normal. It's good plaque. It's there. It's not causing a problem as long as we brush it away every single day, floss it away or rinse it away in some way so it doesn't have a chance to turn from good to bad. But over time, if we're not accessing it with the proper oral home care, like the proper brushing and flossing, then it's going to sit in one spot and it's going to start to grow and it's going to start to convert itself to a stronger, more bad type of bacteria. And then we also, once it gets to a very acidic form, so that's the stuff that will start to eat away at our enamel, then that will show up as a different color as well. So what it does is then I give you the mirror, you can see, okay, where are the issues? Where am I finding the problems? Is it around the gum line? Am I not angling my toothbrush the proper way? Am I avoiding my gums because I'm afraid of recession, which is the biggest thing that I come across. And it's probably the biggest misconception when it comes to proper brushing out there. And really just the understanding of how to do it. And then obviously, if we end up with the very acidic type of plaque, then I know, okay, what does this person have to do on a daily basis? Is it just a fluoride treatment? Or is it something, we don't have cavities because we're missing fluoride, right? There's something else going on. Are we not getting the proper nutrition in our diet? Are we smoking and have more acidic environment? So what can we do throughout the day, like Xylitol products? What kind of things can I do to support my clients when they go home? So when they come back the next time, everything is healthy and we're maintaining good oral health.
Talk about Xylitol products. What are they and what do they do?
Yeah, so xylitol is a natural sugar, believe it or not. It's a sugar that's beneficial and it actually helps protect against cavities. Bacteria will eat that sugar, and normally that process would involve the bacteria releasing acid as a byproduct. Well, this actually starves the bacteria. They can't digest it properly, so they don't create an acid. So it's actually it's inhibiting the acid formation in our mouth, which the acid then wears away the enamel.
Is it a gum or is it a mouthwash? How do you take it?
Okay, well, you can find it in a natural food store, but you want to be careful with it if you're ingesting it high amounts because it can cause digestive issues because it is a sugar alcohol.
Okay.
But you can find it in products out there. You can find it in mouthwashes. Pure gum is out there. Xyli mints. There's a whole line of Oral Science that offers products. Okay. I carry a mouthwash and little tiny beadlets, actually. I carry these little beads that someone can pop throughout the day after a meal, and it has a little bit of coconut oil, which is an antibacterial. It has essential oils that have been proven to kill the bad bacteria in the mouth, and it has some xylitol. So there's different ways, and just based on people's taste preference, and if people have sore jaws, I don't want to send them and give them gum all the time because that's not going to help. Right. So if someone's a smoker, I want something with the essential oils that can help in a different way.
Right.
So I do take a very personalized approach to recommending xylitol.
Okay.
Yeah.
So you paint that stuff on the teeth, and then
Yeah.
you go from what next step?
Next step from
What-
there,
Yeah.
then it's an educational opportunity. So I would go over proper brushing, flossing, find out where you're missing, see if there's any specific tools that you need to help you with your areas of concern. And then obviously we want to clean it all off because I don't want you leaving here with pink and purple teeth. So if there is a lot of plaque throughout, then I would generally use a polisher. And then that will, obviously it's a rubber cup, so it removes plaque faster. And when you're in a dental appointment, you're actually paying by time. So every 15 minutes is a unit of time.
Yeah.
So if you're sitting in the dental chair and they're physically working at chipping away that not enamel, you don't want to chip away the enamel, chipping away the hard plaque and everything, 15 minutes, you're looking at $60
Yeah.
per unit of time. So having that polish, if you have heavy plaque, it gets more surface area cleaned faster.
Sure.
So I do remove that, and then I follow up with something it's called an ultrasonic scaler. This to me is so important, and it's absolutely necessary during COVID. And the problem is it creates aerosols. So right now, with this virus being an aerosol generating virus, we have to be very, very cautious. So I mentioned my air purification, my high volume. I'm doing all of the things to reduce the potential risk, but by not using that ultrasonic, like you can use those little hand instruments, but bacteria is not going to jump on a metal instrument and hitch its way out.
Right.
Instead, it's going to try to protect itself. It's going to create this biofilm under the gums that you can't penetrate. So my ultrasonic scaler will go in, and the ultrasonic motion of it will actually destroy the cell wall of bacteria. So it's going in there, it's killing it, and then it's flushing the area out. And just having that water under the gums is putting oxygen into that environment. So not only are we going to flush out all the bad stuff, but we're leaving the gums with a healthy environment for the good stuff to repopulate. So that to me is absolutely essential, and it blows me away when I find out that people haven't had that experience in the past and have never had that used on them.
It was a different experience for me, but it certainly seemed like you were really getting in underneath the gum and getting into places where you needed to get into.
Yeah. And the whole purpose of the measurement that I do in the very beginning is determine how deep I need to go in certain areas. Like a healthy mouth will have 2 to 3 millimeters, even 1 to 3 millimeters of space under the gums. That's on every single tooth, no matter how healthy you are.
Yeah.
So, those areas you're not going to really even feel it because it's just a normal thing.
Yeah.
But if you have areas where it starts to get deeper, you're having that bacteria growth, you're having these long-term issues arising, whether it's from a deep filling or it's from a previous history of smoking or trauma. There could be a whole host of reasons why, but getting under there and cleaning it is essential to either stop the disease from progressing and losing your teeth down the road, or causing, maybe not causing, but contributing to the other chronic diseases. Yeah, it's just important to get that stuff under there, and it doesn't hurt. I'm not cutting the gums in any way. When you say you're cleaning under the gums,
it wasn't absolutely. There was no pain or anything like that. It was just a different feeling. That's all it was.
Yeah.
But you also can deaden. You can do injections as well.
I can. Yes, I am licensed. I did go and get special training to be able to give local anesthetic freezing.
For really deep cleaning, is that?
It could. You know what? You can have someone that doesn't have those deep issues. But if they bite into an apple and they have a bit of red on the apple, a bit of bleeding, that should never happen. Yeah. That person really, really needs to get that appointment. They need to get the flushing. They need to get something, get that area cleaned out. So it's like having a splinter. It really hurts to get a splinter out. You don't have to have really deep areas to have a problem, and it can hurt. So I do have a topical gel that I can use. I have like a minor, not injectable, but a desensitizer that can help just reduce those people that have that bit of sensitivity to cold. And then, yes, people that have a lot of inflammation and they are bleeding. When you spit, when you're done brushing your teeth and you spit in the sink and there's blood there, you have a problem. Bleeding gums is not okay. If any other area of our body was bleeding continuously, we would go to the doctor because we know that there's a problem. Absolutely. It's considered normal because like 90% of the population has that gingivitis. And what I find, what's out there is not what I find, but what the science shows and research shows is at least 1/3 of the population has more than just gingivitis. It has progressed to a chronic disease. And I'm able to go in there and hopefully stop it and then maintain it from that point.
Excellent. Tiffany, we're almost out of time, and I know we spent a lot of time talking about your dental hygienic business and the great spot you have here. But your process to get here, and I think this is, I just want to take a quick turn on this.
Sure.
Because when we talked partway through this interview, you talked about setting up your business, and then they had to give up the lease, and then you had to less than 2 days to pick it all up, and then you had a baby, and you were pretty well ready to say, okay, may not be for me, but you didn't give up.
Yeah.
So what advice can you give to people, and whether it's maybe people have chronic pain in their mouth and they've just decided they had to live with that for the rest of their life, maybe they need to choose a different path. What could you say to people who say to themselves, I guess this is the best life has to offer me?
Yeah, well, that is a great question, and I don't even know where to start. Ultimately,
persistence
I think it comes,
for you was a big thing, right?
Yeah.
Knowing that wasn't you, that you weren't comfortable with the decision of giving up.
Yeah.
So why were you uncomfortable with that?
Yeah. Well, to me personally, I just saw a bigger vision. We're living in the sickest province in Newfoundland, sickest province in Canada, and I've been around to enough places to see that I wanted to shift that. I wanted to offer a different opportunity. I wanted to be there for people that might have anxiety about going to the dentist, the sounds and the smells and whatever's stopping them, the embarrassment, the mental capacity needed to overcome a phobia of the dentist. Like, it's real. If I was told that I had to lay in a pit of spiders because it was good for my health, am I going to do that? Yeah. I don't know, but people that are afraid of the dentist will sit in this chair and they'll get better. So to me, it was bigger than myself. If I didn't do that, and if I wasn't willing to take the beating of getting this out there, then I don't know if anyone will be able to do it and get out there and help the people that need it, that don't have access. As I mentioned earlier, I am a health coach as well. So I've done a lot of mindful work. These people that I refer to now, I've been coached by them. I've had therapy with them. I've worked on my own self and realizing, like, the ego is one thing, but there's so much more out of there.
Absolutely.
Like, yeah, the mind, body, mouth background is putting the mouth into this, but we have a spiritual response. Like, for people to say that it's not a real thing, the mindset is like, if we can think about somebody and blush, clearly there's something else out there that can cause a physical effect on our body.
Right.
So it's really just trying to find the missing link where, I've had a client in the past that we've tried everything. He's been to gum specialist. He's been to the dentist. He's had a surgery. He's had laser disinfection. He's had a tooth removed, and he's still having issues in a couple areas, no matter what I did. And then I'm like, wait a minute, where did these teeth fall on the meridian chart? And guess what? They were both related to an issue in the gut. So I'm like, maybe his issues aren't tooth related. There's something else in the body. So yeah, to me, it was really just get good sleep, get good food, do what you need to do to be healthy. And if you're healthy, you're able to take on the stress and the challenges that life is going to throw at you all the time. So I don't know if that answered your question, because it's so multifactorial.
It does answer it. And I guess to finish off, I will say to listeners that your sincerity and your honesty show. The time that you took with me shows that you really want to make sure that people leave with less problems in their mouth than they had when they came to see you. So
you're going to make me cry.
So I do really wish you well, and I again, if for those of you who are listening, please go back to very first interview I did with Tiffany on myofunctional therapy, which was eye-opening to me. Again, Tiffany, thank you very much for taking the time out, and I'm going to schedule an appointment for my wife now as soon as we leave here.
Well, thank you for taking the time and doing this, not just for me, but for the community, right? The community of practitioners, but the community, the population that needs this.
Thank you.
So, thanks.
And I wish you well.
Thank you.